Among the most common questions that I get as a holistic therapist are, what is holistic therapy and what's the difference between holistic therapy and physical therapy? The oversimplified answer is holistic therapy is the holistic equivalent to physical therapy. They are the same in that they both strive to correct the same types of problems in the body, such as pain, posture problems, restricted range of motion, and so on. But they are very different in their respective approaches. To explain in more detail, physical therapy, like all conventional allopathic therapies such as chiropractic, massage, and medical treatments like drug therapies and surgery, they all aim to treat conditions by focusing on symptoms. In other words, they use symptoms to determine the type of treatment or therapy the patient will receive. Many of the larger allopathic treatment centers see their patients in assembly line fashion, rushing as many as 4 or more patients per provider through their clinics every hour. This means that in 15 minutes, the provider will assess and document the patient's current condition and improvement, treat the patient with 1 or more pre-established treatment protocols, instruct the patient in home care exercises, and then make record of everything that was said and done during the appointment before moving on to the next patient. I once worked as a receptionist in an office where I scheduled 3 patients for 1 provider to see every 5 minutes. This type of treatment is often very forceful and rushed, and this approach is rarely effective. In fact, forceful techniques can actually cause restrictions in the connective tissue of the body, which is usually what's causing the symptoms in the first place. Forcefully replacing one old restriction that's causing a frozen shoulder with 2 or 3 new restrictions that later cause cluster or migraine headaches might feel good in the moment, but it doesn't really help anyone heal or to permanently solve their problems. By contrast, holistic therapists recognize that healing takes time and that the body doesn't respond to force, at least not in a way that's positive in the long run. The treatments are gentle, and appointments usually average at least 50 to 90 minutes in duration. Instead of focusing on symptoms, the holistic therapist will assess the patient's skeletal alignment and look for physical restrictions in the connective tissue of the body called the fascia to determine underlying causes for the reported symptoms. Once a starting point is established and the treatment begins, the holistic therapist will scan the patient's body for vasomotor responses, which are areas where the surface of the skin turns flush or releases heat. These vasomotor responses can then be used like a roadmap to determine the areas that need to be treated. In other words, the treatment is directed by the patient's unique condition and is dictated by the body rather than by pre-established protocols. And treatments progress intuitively rather than systematically. Here at Transformations Wellness, I will spend as much time with you as necessary to help your body heal and to resume as close to your original state of health as possible for you. Instead of focusing on your symptoms, I will help you tap into your body's own natural healing ability without force, in a relaxed and quiet atmosphere. My gentle approach works with your body rather than against it, and is often faster and much more effective than conventional methods. Please call me today to schedule a free consultation. We'll discuss your individual needs and expectations to determine if holistic therapy is right for you, and I will customize a program that fits your needs.